Scores of unemployed doctors in KwaZulu-Natal have marched to the Provincial Health Department in Pietermaritzburg to hand over a memo of demands. A recent survey by the SA Medical Association Trade Union shows that more than 800 trained doctors in the country are unemployed despite completing 2 years of medical internship and 1 year of community service. Newzroom Afrika's Nobuhle Modise joins us live this morning. She's tracking that story. And Nobuhle, this is a bitter pill to swallow in the context of the failing health facilities in our country, the big gaps that we're seeing in many of our health facilities, and so many doctors seemingly sitting at home.
The backbone of our society being doctors sitting at home, not being able to save lives as they go to university and study to do that. I mean, I spoke earlier to a doctor who was telling me that at this point it's not even about the money, seeing that government is citing budget constraints. You will remember that last week during that press briefing, the health minister, Dr. Joe Phaahla, mentioned the fact that the cost of employment is also just simply high, where it's sitting at 65% of annual budgets, saying that those increases as well of 7.5% and other benefits, like overtime are also constraining the fiscus. So those are some of the reasons. And some of the doctors here are saying they've gone past the point of money. What they want to do now is to assist in helping lives. I mean, KwaZulu-Natal is quite rural, and other rural provinces face this crisis are affected the most, because that means that those who come to offer, those who are able to offer their services are overworked, and then they also face issues of litigation. So it's a major issue, and some of these issues are mentioned in that memorandum that was handed over. But I do have the Deputy Health Minister here, Dr. Sibongiseni, Dhlomo, who did accept that memorandum and did say to them that tomorrow during that SONA debate, the Health Minister will be having some announcements. He didn't let us in on what exactly those will be, but in his response to that memorandum, he said they should look out for that debate, because what comes out from there will essentially be some positive news. Am I correct to say that, Dr. Dhlomo? Thank you very much. You're live in Newzroom Afrika.
I didn't pick up what you'd like me to address. You
mentioned that tomorrow at the SONA debate there will be some announcements that the minister will be making regarding the issue of unemployed doctors in the province.
Yeah, no, thank you very much. But just allow me to give a bit of a background to this process. To say, 10 years ago in this country we were having about 1,200 medical students graduating as doctors. We foresaw that there may be challenges going forward, and therefore approached universities to expand their intakes, but also injected more other training in Cuba, so that to date we have about 2,400 students who exit as doctors. We are positive that almost all of them are placed as interns, and those who are doing internship also are now placed as community services. We have had this challenge as community service, post-community services, and it's just a first time that we have it in this magnitude. And we agree with some of the things that are coming in from the memorandum of the doctors to say, can the government look into this issue of decreasing top slicing Department of Health, because if you actually do budget cuts and you also affect health in this way, you are likely to experience challenges. I mean, we now have to actually decide in the department, do we buy more ambulances, buy food for the patients, or decrease intake of more doctors, which therefore is something that we always find it difficult to do. Yes, so we are committed, and we really would say we don't regret having really started the process of improving the pool of medical students to become doctors. And we just want to say that injection is assisting us greatly, because some of these doctors are available now to go to the hospitals that never had doctors in the rural areas, in the rural clinics. And therefore, we just want to go over this hurdle of the fiscal constraint. But the discussion that I've had with the minister over the weekend was that he has had meetings with the Minister of Finance, and there are positive developments that the minister will announce in our budget, SONA debate tomorrow. I've really addressed the unemployed doctors to say, let's look into that issue positively, but let's also find time to detail looking into the memorandum that they've brought to us. We really don't disagree with them. We are part of us. I mean, the improvement of health services is our key, and they can only improve, among other things, by injecting good health, disciplined, and also, well-qualified doctors and nurses and all healthcare professionals. So in that space, we agree. Hence, our motivation and our agitation as a Department of Health, even nationally, to engage the Treasury on this matter.
And then, Deputy Minister, we have two ends of one stick. So the unions are saying that this boils down to corruption, and the doctors are saying that it's not necessarily, yes, there's an element of corruption, but they're saying that there's a mismanagement of funds. And you're saying, yes, you agree with the notion that budget constraints cannot be the reason why we're unable to hire more doctors. What is your response to this, where the unions are saying this is a matter of corruption, the doctors are saying it's an issue of mismanagement of funds?
I don't have their basis for that. I would not know that. I have been part of leadership of health in this province for the past 10 years, and I left now. I'm a national. Whenever there are issues of corruption, we have what you call an anti-corruption health forum, where some issues like that will be reported. So I really urge anybody who wishes to have that taken seriously to report it on that issue. I would want to say, among the things that we note, we also have been at pains to say if you don't have enough healthcare workers at any given time, the few that are there are likely to have mistakes and therefore have a high number of medical legal claims. So I've always been saying you don't know which comes first, the egg and the chicken. You need to begin to say, where do I start improving? But we are saying the improvement of health personnel within our health facilities is going to really alleviate this process that we are talking about. But we need to engage the unions, because in this district where we are standing today, this district, among other things, has hospitals that have got what you call a rural allowance. And there are very few that are rural here. The reason why they were supported by a rural allowance was that those hospitals, Itindale Hospital being one of them, now called Herikwala Hospital, was actually in an area where there is a high turmoil of violence. It was actually very difficult to get doctors to go and work at Itindale, Kwatambuza, Kwapata. So to motivate them to go there, you had to actually improve and put another allowance. The country is stable now. Those hospitals are no different than the rest in terms of the crime in and around the country. So we must actually be engaged and engaging unions to revise. Should we or should we not continue the rural allowance in those areas? Because a rural allowance given to you, Dr. Dhlomo, if taken away from another doctor, might actually begin to fund another doctor. So we must look into those issues. But those are things that can be discussed. We can't do it overnight and have to go on through that.
And then lastly, Deputy Minister, before I let you go, because I know that you do have to leave. I mean, let's speak about the NHI. The doctors here are saying it's beautiful on paper. But how is it going to work if now we have this crisis of being unable to place those doctors for post-community service?
We are improving this issue of funding. But number two, where you actually miss it out is on NHI. Because on NHI, there are hospitals in this country that are running half empty in terms of patients, and those healthcare workers who are there are actually not really doing much. So we're actually saying in the NHI, patients should not live here and only go to Herikwala Hospital and say there are medical clinics in this province, in this town, who will not admit unless there's an agreement on the price, and therefore those hospitals are equally full and take the load. Because what is happening for now, some of the patients are going there and actually in big numbers, because there are hospitals that cannot take unless there's the high amount of money paid. So we are saying public health is a public good. It should be made available in the private and public. So that part will be addressed as part of actually say doctors also in the rural hospitals and clinics. So NHI is actually driving the primary healthcare focus, because we would want to go that route, and that we are waiting for the president to sign. So this is not actually, among other things, this issue of unemployment is something that is being addressed worldwide. It just came to us because of the fiscal challenge right now. But I don't want to say the fiscal challenge should then stop us in our vehicle to get NHI. Because NHI is going to be actually addressing your grandmother and my grandmother to be picked up by any ambulance and not be disadvantaged on the side of the road because they happen to be not having an insurance for them. The insurance is going to take care of all citizens.
Thank you very much. That is the Deputy Health Minister, Dr. Sibongiseni Dhlomo, there, just summarizing for us, their response to that memorandum of demands that was handed over by doctors who were marching here today. And you heard him just say that he's still confident that the NHI is still a good idea for the country, and him also saying that he does agree with many of the doctors here today when they say that, budget constraints cannot be the reason why hospitals are understaffed and why some staff are overworked. Back to you in the studio.
Yeah, absolutely. Absolutely, and no clear solutions there from the Deputy Health Minister either. Nobuhle Modise, let me thank you for your time live to us there in Pietermaritzburg this afternoon.